We're seeing a new milestone in the U.S. vaccination drive. Look at these images, the very first doses going into children's arms, children as young as 5. About 28 million American girls and boys are now eligible for the shots. Let's go to Washington and our reporter there, Chris Reyes, who has more. Pretty amazing. Those were images out of Connecticut. Kids getting the very first shots after the CDC went ahead with giving final approval, wasting no time in getting into this age group, Chris.
That's right. Good morning, Heather. They looked pretty happy, didn't they? One boy went like this, which is a surprise. Yes, so those are some of the first kids in the U.S. To get the COVID vaccine. They actually were administered last night. 2 of the first kids to get the vaccine, however, got it in El Paso, Texas. Their names are Tinsley and Paisley, and that happened last night as well. Now, even before the CDC's recommendation came down, Pfizer did announce that millions of doses had been shipped across the country. And so when these shots will exactly get into kids' arms will vary from state to state, but they are arriving as of this morning. So Walgreens, a big pharmacy chain here in the U.S., for example, posted online that they're taking appointments starting this Saturday. One county in California will be taking walk-ins this morning. And the president did announce yesterday in a statement that while administering the shots will ramp up this week, it should be fully operational starting next week. Now, some parents are eager to get in line to get these shots, but other parents are concerned. In fact, some parents worry that kids will be required to get the shots to go to school. And many doctors in this country say that's not a good thing, the fact that parents can't trust this vaccine. Many doctors on the advisory panel to the CDC yesterday said that they are parents themselves, and they're going to be giving this shot to their own kids, and that in order to stem another wave like the Delta variant, kids 5 to 11, school-age kids, need to get the shot. Have a listen.
People should realize that a choice not to get a vaccine is not a risk-free choice. It's a choice to take a different risk, and I would argue a more serious risk.
You know, it's more emotional, I think, just knowing that, oh my goodness, we're at this final stage where we're all can be vaccinated. So, but I do feel confident, and I feel really, really positive about the situation.
Heather, since the start of this pandemic, it's worth noting that about 6 million children here in the U.S. have been diagnosed with COVID, and that really peaked with the Delta variant, which is, again, why many doctors in this country are recommending that kids 5 to 11 get the shot.
We've seen, Chris, in recent months, the U.S. vaccination drive has really stalled in some states, particularly in the South. So what are we hearing from public health experts there? Are they expecting there will be other challenges in getting these kids vaccinated?
Well, Heather, I don't know if you've ever taken a kid to get a shot, and that's difficult enough. You know, I took my kid to get his flu shot a couple weeks ago, and 2 nurses had to hold him down. And so what we're seeing in these hospitals or these mass vaccination sites, obviously preparing the space for kids. Lots of teddy bears, lots of pep talks, lots of educational videos leading up to the shot so that they're not so scared. Because again, we're going to be seeing these sites full of children, and you know, they've been hearing about COVID for the last year and a half, and many of them are anxious. Doctors are also reminding parents that kids can experience the same side effects as adults, and that includes fevers and chills. And so if they want to prepare their kids even before they take them to get the shots, there are a lot of videos online that may ease that anxiety.
Chris, thank you so much. Chris Reyes reporting for us from our bureau there in Washington.